not because of the inherent flaw of the study, but it doesn't make sense in the context of the golden standard. But the golden standard had nothing to do with teratology. It had to do with heritable forms of microcephaly. These are environmentally induced microcephalies. It's not that the gene came in and said, don't make the brain. No, the genes were fine, but the radiation said, die and reduce your size. So it's comparing apples and pears. And then there is a study in Sellafield. An editor from a reputable journal one time said I misquoted it, and I said, you better read it again. Because these are very subtle paragraphs here and there, but nonetheless the most common anomaly among the most commons are neural tube defects, and there it is. But, there were a lawsuit about leukemia clusters near Sellafield and so on. The atmosphere was very charged. This study was not repeated. Then EuroCat does 2 studies, but doesn't study anybody near Chernobyl. Okay, only Western Europe, way out there. And good, bad, or indifferent, they say that we don't see anything. This is the path of the radiation and circling around England. And when we compare the actual rates that EuroCat reports, to our surprise, yes, Polossia region is the highest, but so is Northern England, Wales. And we can see the highest rate, the second highest rate, the third highest rate, and we keep finding these regions in Wales and Northern England. I don't report those data. Those regions report the data. They don't report to me, they report to EuroCat, and we report to EuroCat, and supposedly we are trying to use the same methods, but it is imprudent to statistically compare these things because still there are a lot of confounding factors that one didn't explore, but simply it's an informational piece. And Dr. Yablokov and many others have pointed out that mental health is a big problem. Is part of the radiation syndrome. So in Sweden there are studies, and in Norway there are studies that show that those who were in utero at the time, in the center of those 2 countries, independently, they find cognitive deficiencies. So that is consistent with that subclinical reduction of the head that I was showing you before. So we have arrived basically at the end of the trip. So what do? We cannot say that this study is cause and effect. This study is a descriptive study. But we do provide a foundation for cause and effect. We have a specific population, we have a specific pattern of malformations, and we have a specific geographic area. Rather than running around and reassembling the liquidators and getting at random a bunch of mix-up ethnologies and different varieties of people and then extrapolating results. We have a population registry of every baby born in the last 10 years with name of the mother and everything else. So, what do we conclude? Either we are not talking about reality and I wouldn't be here. We waited for 3 analyses, and I think that, from our side, that's not so. Now, those who think that this is unreal, whether they are IAEA or whoever, they are welcome to come and check the data. Or, these malformations are there, but they are not due to radiation. So that those whole body counts of pregnant women and potatoes and all that, that's totally irrelevant. Prove it. Let's prove it. I think that's important enough to dismiss it with some prospective case control or whatever other epidemiologic studies you wish. Not this one. This one opens the key and the door to facilitate and expedite such an investigation. Or maybe the fetus is far more sensitive than the standards we apply to it. And finally, maybe actually the doses are not what they said to be. And probably all of these factors, plus alcohol, plus malnutrition, plus lack of folate acid, and plus of so many birth defects, congenital malformations, require the convergence of two things. Multiple things that disrupt the development and multiple things that disrupt the repair of the damage, because we have regenerative capabilities. So you have this balance, and if it is unbalanced, then the morphogenesis of the embryo becomes altered. So I did not talk about conjoined twins, but that's what we see. I did not talk about teratomas, that is what we see. I did talk a little bit about neural tube defects, but there are many subcategories and associations. I did talk with microcephaly, and I did not touch much about microphthalmia, but there are all kinds of things that the world needs to know, because these birth defects occur in China and Indonesia, India, and anywhere else, and the more we know, the better we're going to prevent them. So what I want to tell you is that as a physician, prevention is first, not epidemiology. And we know how to prevent. We know that in China, this is J.R. Berry, a good friend, who spent part of his life, his children went to school in China in order to do this, that he proved conclusively that you can reduce 50% or more neural tube defects by one pill that costs, you can get about 60 pills for 60 days for the price of one pack of cigarettes. And we can't find the pills. So it is an immediate need to act. And we have been working with the government, and yes, tomorrow, yes, tomorrow, yes, tomorrow. It needs to be done. I agree. But secondly, these people don't need to be exposed to radiation because they don't need to swallow it. Give them milk, give them potatoes, give them flour, but bring it from somewhere else. Then we know about alcohol and campaigns about alcohol. And the authorities have enough resources and know-how to do it today. But if international partnerships step in, that's more likely, and it's more likely to be done better. And the existing monitoring can show, not just to Ukraine, but the world, all the nuances of prevention. For instance, is folic acid going to prevent neural tube defects when you have a bunch of people exposed to radiation, or is it going to be totally ineffective? And if it is effective, would it be effective in Fukushima, regardless if they have spina bifida or not? Should Fukushima exposed people get folic acid? Those are questions that transcend Ukraine and call for solidarity. And Western Europe needs to learn a little bit more, because we are the only program unfunded by the European Union. There are 39 programs. We are the only ones who don't get a penny to monitor congenital malformations that they publish. And if Chernobyl is not relevant to Europe and congenital malformation threat, I'm sorry, but I'm confused. So here is the can-do principle that some people alluded to, and I want to dedicate this lecture to this little child. We detected her before she was born. I found her abandoned in a hospital because the mother wasn't even told that she had a living child. The mother was told, you delivered a monster that was dead, and go home, forget it, try again. The mother got so depressed, she left the country. And here we have this little orphan that has no hip, no sex, no ovaries, no uterus, and full of joy of life. She ends up in an orphanage, and we find the grandma, who eventually comes and picks her up. The grandmother brings the mother. This child now is a high school graduate somewhere in Western Europe. It proves 2 points. We can do, but also their brain is spared because these anomalies are very early ones, and if you don't die, you're going to develop everything else like everybody else. If the damage is late, regeneration is diminished, and you cannot restitute what you lose as much as if you start very early. Think of congenital twins. Every monozygotic twin is a congenital malformation that is perfect otherwise, but it's a malformation nonetheless. And that's a typical, from one, I get exactly a copy of another. I regenerate me. So thank you for your attention, and I hope you join us.
Thank you, Dr. Wertelecki. I think it's always important to remember that we're talking about real people and that our consequences, both for good or for evil, affect real people. He also introduced, I think, or reintroduced 2 issues that are very important for us. One was brought up yesterday, which is the notion of an ecological half-life, that it's not just about looking at radionuclides and their decay rates or their biological effects, but how do they cycle within systems and ecologies, and how do they continuously re-expose us. And that the people that currently are doing most of these analyses are basing their assumptions and information using data that is not really relevant because these long-term chronic exposures are very different. And we must take that into account and address this issue, which was almost completely ignored in the most recent WHO report.